All right, welcome back to the Dupe Dive. Today we're going somewhere I bet most of you haven't been before.
Oh yeah, this one is pretty niche.
Yeah. But it's a really cool example of just how intricate the human body is. How like all these systems, especially during something as massive as pregnancy, have to work together perfectly or things can go wrong in some pretty unexpected ways.
Absolutely. That's what we're talking about today.
Sheehan syndrome.
That's right.
Huh.
And by the end of this deep dive, you'll really understand what Sheehan syndrome is, how it happens, and what the consequences are, but also, thankfully, what the treatments are.
Right, exactly. And thankfully, there are treatments for it. And we're going to be drawing all of this from, descriptions from medical experts, a bit of the history of how this was even discovered.
Oh yeah, fascinating history there.
And then, what's the latest research telling us? So to kick things off, let's just get right to it. What is Sheehan syndrome?
Okay, so Sheehan syndrome is, well, it's a form of hypopituitarism.
Hypopituitarism.
Right. So that basically means the pituitary gland in your brain, it's this tiny but really important gland that produces all sorts of hormones.
Right.
In hypopituitarism, it's not producing enough of those hormones.
Okay.
And in the specific case of Sheehan syndrome, this happens because of something called ischemic necrosis of the pituitary gland.
Ischemic necrosis.
Yeah,
Yeah.
it sounds a bit scary, but it basically means the pituitary tissue isn't getting enough blood and starts to die. Like a plant that withers if you don't water it. And the thing that triggers this whole process is get this severe bleeding after childbirth.
Postpartum hemorrhage.
Exactly. So you have this event, this major bleeding, and then down the line, it can end up damaging this tiny little gland in your brain.
So that is the link then, right? Like how does losing blood after childbirth end up affecting something all the way up in your brain?
Right. And you know what's really interesting? This connection was first really laid out by a guy named Dr. Harold Leeming Sheehan, like way back in 1937.
Wow, that is a while ago.
Yeah. And another thing that's interesting is that while Sheehan syndrome can happen anywhere, it's actually way more common in developing countries.
Really?
Yeah. Places where maybe there's not the same access to really good maternal care, or maybe postpartum hemorrhage is more common for other reasons.
Huh. So it really highlights how important that is.
For sure. It's not just about, surviving childbirth. It's about long-term health too.
So let's get into the nitty-gritty now. How does this actually happen? What's the step-by-step of how bleeding turns into this pituitary problem?
Okay, so picture this. You have a really bad bleed after giving birth, right? That means you're losing a lot of blood volume really fast.
Right.
And that causes your blood pressure to plummet. We call that hypotension.
It makes sense.
And when your blood pressure drops that low, your body has to make some tough choices about where to send the limited blood it has left.
Like a triage situation.
Yeah, exactly. And unfortunately, the pituitary gland, even though it's super important, it kind of gets left out in the cold. It doesn't get the blood it needs, which we call ischemia. And to make matters worse, during pregnancy, the pituitary actually gets bigger and grows more blood vessels. It's prepping for breastfeeding.
Oh, wow. So it's actually more vulnerable during pregnancy.
Exactly. It's kind of a cruel irony.
Mhm.
And if this lack of blood flow is bad enough and goes on for too long, well, the pituitary tissue actually starts to die off.
Mm.
Necrosis.
Okay. Wow. And you said earlier it was specifically the anterior pituitary, right? What? Just that part.
Good catch. So the pituitary is actually made of two parts, the anterior and the posterior. The anterior pituitary is the one that makes all these key hormones, ACTH, TSH, FSH, and LH, growth hormone, prolactin, the ones that control your stress response, your metabolism, your reproductive system, milk production, all that.
Right.
The posterior pituitary is more about fluid balance. It makes ADH, the antidiuretic hormone,
Mhm.
and for whatever reason, it usually doesn't get affected in Sheehan syndrome, probably because it has a separate blood supply.
Interesting. So it's really this cascade of hormonal deficiencies.
Absolutely. One thing leads to another, and you end up with this whole system out of whack.
Now, before we get into the specifics of those deficiencies, what are the things that make someone more likely to develop Sheehan syndrome in the first place?
Well, the biggest one, obviously, is having a really bad bleed after childbirth, postpartum hemorrhage.
Mm-hmm.
But there are other things that can increase the risk, too.
Like what?
Well, a really long and difficult labor can be a factor, probably because it puts so much stress on the body.
Right.
And having had multiple pregnancies before, what we call multiparity, that can also increase the risk.
Any idea why that would be?
Honestly, it's not totally clear. Some researchers think maybe there's some kind of cumulative damage from each pregnancy, or maybe the blood vessels change a bit over time, making them more susceptible.
Huh. That's interesting.
Then there are things like preeclampsia and eclampsia. Those are conditions where you have high blood pressure during pregnancy, which can mess with your blood vessels and make postpartum hemorrhage more likely.
What?
And finally, there are some blood clotting disorders, coagulopathies, that can increase the risk of bleeding in general.
You also mentioned a couple other things, like the size of something called the sella turcica.
Oh yeah, that's kind of a weird one.
Yeah.
So the sella turcica is this little bony structure at the base of your skull. It basically cradles the pituitary gland. And some studies have found that people with naturally smaller sella tursicas might be at higher risk for Sheehan syndrome.
Why would that be?
Well, one theory is that if the sella turcica is smaller, there's less room for the pituitary to expand during pregnancy, which we know it does. So it's more likely to get compressed if there's a sudden drop in blood pressure.
Makes sense.
And there's also some evidence that there might be an autoimmune component in some cases, like maybe your own immune system attacks the pituitary. But that's still being researched.
So it's complicated. A lot of things can contribute.
Yeah, for sure.
So how does this all actually manifest? Like, what does Sheehan syndrome look like in a person? What are the symptoms?
Well, it can actually present in a lot of different ways.
Mm-hmm.
Sometimes it's really dramatic, like right after delivery. Other times it's more gradual, these symptoms that creep up slowly over time.
Okay.
In the acute phase, right after the hemorrhage, a woman might be in shock, have really low blood pressure that doesn't come up easily.
Right, because of the blood loss.
Exactly. But one of the biggest red flags, something that should really raise alarm bells, is if a woman can't produce breast milk. We call that failure to lactate.
Oh, wow. And that's directly because of the pituitary damage.
Yeah, specifically the lack of prolactin. That's the hormone that's responsible for milk production.
Right, of course. And what about the longer-term effects, the chronic symptoms?
Well, this is where it gets really interesting and kind of sad, too. Because remember, the anterior pituitary makes a whole bunch of hormones. And when it's not working right, you get deficiencies all over the place.
So each deficiency causes different symptoms.
Exactly. So, for example, if you're not producing enough TSH, you end up with hypothyroidism.
Hypothyroidism, okay.
Which means your metabolism slows way down. You might feel tired all the time, gain weight without trying, always feel cold.
Right.
Then there's FSH and LH, the hormones that control your reproductive system. If those are low, you get hypogonadism.
Okay, another one to remember.
Basically, it means your ovaries aren't working right. You might stop having periods altogether, have trouble getting pregnant, lose your sex drive.
Wow.
And then there's ACTH, which controls your adrenal glands. If that's low, you get adrenal insufficiency.
Which
So it
is?
means your body can't handle stress as well. You might feel weak, have low blood sugar, and yeah, that low blood pressure can be a problem here too.
So many things affected.
And we can't forget about growth hormone. If that's low, you might lose muscle mass, have low energy, all those things. And of course, the prolactin deficiency is what causes the problems with breastfeeding.
So it's really this domino effect, huh? One event, this hemorrhage, can trigger all these long-term problems.
Exactly. And you can see why it might be hard to diagnose sometimes, right? If someone doesn't connect those symptoms back to the childbirth, it can be tough to figure out what's going on.
Totally. So how do doctors actually diagnose Sheehan syndrome?
Well, a lot of it comes down to just being aware of it. If a doctor knows that a woman had a really bad bleed after childbirth and she's having some of these symptoms, they should definitely be thinking about Sheehan syndrome as a possibility.
So paying attention to the history.
Absolutely.
Yeah.
And then there are some blood tests they could do. They can measure the levels of those pituitary hormones directly. ACTH, TSH, FSH, LH, growth hormone, prolactin.
And if those are low, that's a pretty good sign, right?
Yeah, but they also need to look at the hormones that those pituitary hormones control, like cortisol, T4, estrogen, testosterone. If those are low too, it really points to a problem with the pituitary itself.
Right. And I imagine they use imaging too.
Oh yeah, definitely. An MRI of the pituitary can be really helpful.
Yeah.
In Sheehan syndrome, it often shows this thing called an empty sella turcica. It basically means the pituitary gland has shrunk so much it's not even really visible anymore in the MRI.
Wow. So they can literally see the damage.
Yeah. Sometimes they might see just a generally smaller pituitary, even if it's not totally gone. And there are some other more specialized tests they can do too called dynamic testing.
What's that?
It's basically giving the body a little nudge, like with a medication, and seeing how the pituitary responds.
Oh, interesting.
Yeah, it helps them figure out exactly how well the pituitary is working, which hormones are being affected the most, that kind of thing.
Now, are there any other conditions that might look like Sheehan syndrome? Things that could make the diagnosis tricky?
Yeah, that's a good point. There are definitely other things that can cause hypopituitarism, so doctors have to rule those out too.
Okay, like what?
Well, sometimes a tumor can grow on the pituitary gland and interfere with its function. Or you can have this condition called lymphocytic hypophysitis, which is basically inflammation of the pituitary.
Hmm.
And that can actually happen after pregnancy too, which can make things confusing.
Oh, wow. So it really mimics Sheehan syndrome.
It can. There's also the possibility of, a traumatic brain injury. If the pituitary gets damaged in an accident or something, that can cause similar problems.
Right. Makes sense.
And then there's some genetic conditions that can cause hypopituitarism from birth.
Yeah.
But those are pretty rare.
So it's important to consider all the possibilities.
Absolutely. You got to get the diagnosis right
Yeah.
before you can start treating it.
Speaking of treatment, what can be done for someone who has Sheehan syndrome?
Well, the main thing is hormone replacement therapy. It's basically giving the body the hormones that the pituitary isn't making anymore.
Okay.
So, for example, if someone has hypothyroidism because their TSH is low, they'll take levothyroxine, which is synthetic thyroid hormone.
Makes sense.
If they're having problems with their menstrual cycle or fertility because of low FSH and LH, they might take estrogen and progesterone.
Okay.
If their adrenal glands aren't working right because of low ACTH, they'll need to take glucocorticoids, like hydrocortisone.
Right. Replacing all those missing hormones.
Exactly. And sometimes they might need growth hormone, too, if that deficiency is causing problems. The key is to find the right doses of each hormone and adjust them over time as needed.
So it's a lot of monitoring and fine-tuning.
Yeah. And it's really important to keep an eye out for any long-term complications that can happen because of the hormonal imbalances.
Like what?
Well, things like osteoporosis, which is weakening of the bones, that can be a risk if you're not producing enough estrogen. And cardiovascular disease, heart problems, can also be more likely in people with hormonal deficiencies.
So it really is a lifelong management thing, huh?
It is. But the good news is, with proper treatment, most women with Sheehan syndrome can live totally normal, healthy lives.
That's good to hear. What's the prognosis like for women who don't get treatment?
Well, that's where things get more serious. Without treatment, they're at much higher risk for all those complications we talked about. They could even have something called an adrenal crisis, which is a life-threatening emergency.
Wow. So early diagnosis and treatment is really crucial.
Absolutely. It can make all the difference.
Now, are there any new developments in the world of Sheehan syndrome? Any exciting research happening?
Yeah, actually, there are some pretty cool things on the horizon. One area that researchers are really excited about is stem cell therapy.
Stem cells, so like trying to regrow the pituitary tissue.
Exactly. It's still very early days, but the idea is to use stem cells to repair the damage that's been done to the pituitary.
That would be amazing.
It would. And there have also been some big improvements in MRI technology, which means we can detect changes in the pituitary earlier and more accurately.
So catching it sooner.
Right. And then there's a lot of work being done on the genetics of Sheehan syndrome, trying to figure out if some people are just predisposed to it because of their genes.
Interesting. So understanding who's at higher risk.
Exactly. And that could help us with prevention down the road.
I also